Press the bell icon on the YouTube app and never miss another update.
By the time I passed out of medical school in 2005, India still revered its doctors. Medicine was considered a noble profession and doctors second only to God. After all, the French writer-historian Voltaire once said, and I quote, "Doctors even partake of divinity, since to preserve and renew is almost as noble as it is to create." The last decade, however, has seen things take a very grim turn. Violence against doctors has been on a steady rise, and more often than not, the causality has extended beyond the purview of a doctor. Infrastructural deficiencies, a paucity of human resources, political misalignment, laxities on the part of non-medical personnel, including nursing staff, class 3 and class 4 employees, and so on. This has amounted to doctor bashing for reasons far beyond the control of doctors themselves. It is indeed disappointing to see that it took a pandemic of this nature and magnitude to restore said values and faith in the tireless healthcare worker. Come 2020 and the coronavirus disease outbreak, many steps have been taken by the administration which have celebrated doctors, but at the same time, there are so many stones left to be turned. This week on Healthcare Insights, let me take you behind the scenes and behind the proverbial and literal mask to show you what doctors have been doing to fight the dreaded pandemic. The Charter of Duties, when it comes to allocation for COVID, doctors are segregated according to their specialty and their alacrity to deal with emergencies. These range from triage or screening duties, fewer wards, quarantine facilities, general care, specific care, and intensive care. For most of these duties, doctors must don full gear. By full gear, I mean a personal protective equipment or PPE, headgear, a face shield, an N95 respirator, sometimes with a 3-ply mask on top, gloves, and shoe covers. For people who are critical of doctors even at this juncture, it would actually be a good exercise to try and don a PPE. Even a few minutes inside that suit are enough to make one crave for air and water. And imagine doing that on a daily basis for 6 to 8 hours at a stretch, 14 days in a row. Trust me, it is not easy. Add to this the level of care that needs to be administered, the constant monitoring, the sheer workload which is thrust upon a handful of doctors, sometimes just 2 or 3 doctors handling 40 to 45 patients in a COVID facility. This is nothing short of commendable. Furthermore, in COVID facilities, relatives are not allowed to meet the patients, and thus the onus of even general care of patients falls onto healthcare workers. What happens to healthcare workers once they finish this 14-day period of duty? Ideally, doctors are supposed to undergo a mandatory 14-day quarantine period. After this, which itself has been shortened to 7 days and in some states even 5 to 6 days to compensate for the shortage of doctors. The shortage of doctors who are relieving them and the ever-increasing patient load. Both these factors bring down the quarantine period, and while there were promises of an additional incentivized stipend to cover for the extra COVID duties, there are now reports that the same is not being levied on the quarantine period. Imagine how unfair it is to strip in an incentive for a time period which is mandated by the World Health Organization. Let's come to deaths due to the coronavirus disease. So the global case fatality rate is between 2 and 3% for general population. But for doctors, if you look at the death rate, you have an alarming 11 to 15% case fatality rate when it comes to doctors who are doing coronavirus duties. So the coronavirus outbreak has been likened to a war of sorts where, doctors are soldiering on at the front line. The major difference, in my opinion, between a war time and right now is the lack of rigorous training for an ever-increasing or ever-changing disease pattern, ever-changing treatment regimens and learning, improvising and treating patients on the go. This is something that nobody prepared us for. Another facet of this is that while on duty and during the quarantine period, doctors must stay away from their loved ones. They actually have to protect their own loved ones as well, parents, spouses, children, so as to not transmit the infection to them, which is, in my opinion, the most significant COVID-19 paradox. All these factors, being amidst COVID patients with the constant fear of infection and disease despite protection, a total lack of personal time, an abbreviation of the quarantine period by, because of shortages, distancing from loved ones, these can really, really overwhelm an individual and render him or her susceptible to an occupational burnout, which is a universally recognized phenomenon. Even doctors who are not involved in an active COVID role are discharging their duties. They're meting out care in whatever capacity they can. After all, medical emergencies haven't halted, surgeries haven't stopped, diseases haven't been eradicated, and healthcare services continue as always, albeit with a much higher in fact, risk of exposure, where 25 to 30,000 plus cases are being added to the national tally even on a daily basis today. All for what? All for a simple notion that the show must go on. This is not the time for critical appraisals and unearthing bygones. This is in fact the time to be united, aligned, and to stand in solidarity with doctors and the healthcare system. Until next week, this is your host, Aseem Sharma, imploring you to acknowledge and commemorate the efforts being put in by doctors across the globe. Have a great week.